أيوة صح.
السلام عليكم ورحمة الله وبركاته. طبعا طبعا هتكون أول حلقة إن شاء الله تعالى، مجموعة من الحلقات بنستمر على الله أعلم يعني weeks or month or year depending on a lot of factor. Can you hear my voice clearly? If you have any question you can write it down in الشات. طبعا my colleague حور الكعبي, she is one of the organizer, will be reading them and إن شاء الله تعالى we'll discuss all your question as we go. فطبعا I want to start by sharing our new website. I hope you have a chance to go through it. It is one of the initiative. With my colleague Mohammed Rawahi, and basically it is to share knowledge related to clinical research. طبعا it has a different web page. If you navigate home, there is also the about the founders and we can see the program. All announcement for a session will be through the program function. We have resources. طبعا resources we have example of publication, but inshallah soon we'll share other resources like, for example, the sample size calculation. We have also wall of impact, and basically we're trying to share stories of some of our colleague. You recognize this person. He's Dr. Salam, Dr. Basma Shamsi as well. And we'll be sharing other result, our other achievement of other results, inshallah. We have also active research icon, and this is basically trying to recruit participant for our research. And this is one of our research. We are trying to recruit some residents from different program with our colleague Fatma Shamsi, Fatma Mahrouqi. And also there's one icon to share news of our resident. And as we go, we are going to improve this, inshallah. طبعا today's session is sound like basic, but I'm trying to admit people as well. But honestly, it's very important from clinical observation to research. And one of the common challenge we face with a researcher either here or locally, طبعا locally or internationally, the concept. You see a lot of duplicate research, or you see a research that has been done and people spend a lot of time, and then by the end it was found is not publishable. So how to avoid that? By trying to go back to some of the basic, which is what are the type of research that will make it to impact. And basically when it comes to our clinical work, having observation either about patient or process or medication, that definitely will result in impactable question. But we try to طبعا our session transform clinical observation to research, and also we'll try to share how to conduct exploratory literature reviews using PubMed, and how to formulate focus research question using PICO framework, and how we can choose appropriate study design for your research question. and most importantly, assess feasibility of your research project. For clinician who is working with patients and clinical field, it all starts with observation. Observation should start, you do your clinical rounds, you see patients in the ward, you see them in the clinic. Sometimes you have puzzle about a process that it is not clear. For example, you don't understand why the outcome is different, or why this medication works in some patients, or why some patients survive, why some patient died, all of this puzzle. And you should, good research is driven by curiosity. So when you have that in your background, then you can achieve very well. There's a lot of people actually joining, and I have to admit them manually. Let's start with a real example. In our series, we'll try to bring real example of something happen in our setting, and then it make it impact globally. But one of the common one observation that we have seen in general medicine, clinical round, constipation is common, and you see this like your patient admitted under care of general medicine, and then they report constipation. That is very one of the common complaint. And then you have that observation: people who were constipated tend to be more sick, and you have that question whether that associates also with poor outcome. So questions that came to our mind: how common impact, or how common the constipation, and whether constipation has impact on outcome, and are we treating it? So this is actually clinical observation that drive a lot of questions. And then that was a foundation for a study that we have done in our department. And then what we concluded, prevalence of constipation among medical hospitalization 62.45, which is very high. And actually it associates with increased mortality, longer hospital stay, and high readmission. And as we go, I'll be using this example again. Another things, delirium. Delirium, we have medical students. For delirium, it means when people admit they are confused or acute brain dysfunction. And as observation, we have it a few years ago. We have reservation that people who has delirium, they tend to be treated by benzodiazepine, which is not a great option because it will worsen the constipation. So we have this question again: among those who were admitted under the care of general medicine, how common the delirium? So basically, that observation about a concern how to treat delirium and whether it's common driven a question. And that resulted actually in a series of studies. So for example, we started with phase 1 study trying to look into the prevalence of delirium among medical hospitalization, and that was by itself a study resulted in outcome, which is prevalence was 55.4. So we recognize, and that was one of the first study probably in our setup, one of the very few study in Middle East. And then we went to the phase 2, which is trying to see whether delirium it is associated with outcome, and actually recognize it was associated with increased mortality and length of hospital stay. And that actually it is again highly cited study. And then we have that curiosity whether there is anything that can predict delirium among medical hospitalization. And then we came with this machine learning model, and that resulted in outcome as well as study. And then we came this question how we can prevent them. And then we went into a lot of things, trying to try non-pharmacological treatment versus pharmacological treatment. And then we came with this studies. We identify gaps. Melatonin potentially can treat constipation. So then we ended up doing an RCT. So basically, an observation happened during the medical round, resulted in a series of questions, and that resulted into like multi-phase studies, yielded high quality publication with high citation with good impact. And that is totally in like opposite what we see sometimes when the things like people trying just to duplicate study, and then eventually will spend a lot of effort and there is no publication outcome. So how to turn observation into research? So you work every day, and do you have a question about like certain pattern happen with the patient, for example, people who with heart failure, could cause heart failure, how they do, how they progress, what is the outcome of their treatment? Do you see them after 5 years? What is the mortality? So this is an example, and that will drive questions. Why did this happen? For example, why some patient with acute decompensated heart failure come back to hospital while other they don't come back? And again, sometimes you might have a question or observation about the impact. What's the impact of starting 4 pillars heart failure treatment on the outcome, like mortality? So that again, a question about the impact of treatment. And sometimes also you might have question about a gap. Like there is uncertainty about outcome or link between disease and things. For example, when it comes to constipation, things we identify calcium channel blocker, one of the strong predictor of constipation, which is something very unusual. And the questions again, when it comes to observation, it might be about solution. Like I have a problem, what would be the solution? So this is all this type of like things should drive you to come with a concept, to generate a question, to translate it into proposal, and then to start doing your research. And what are the common source of research idea? Unusual cases, and that can give you a case report. For example, you are working in a hospital, you are with this patient, you find out his presentation and manifestation cannot be explained by any disease, and then you work hard, you diagnose, and then you conclude this is an unusual manifestation of common disease, for example, or this is a brand new diagnosis, or this is something, whatever. All type of this can result into case report. You are, again, new technologies can be the driving things for a research idea. Practice variation, for example, you treat a lot of people with DKA, and then you have this question, whether continuation of long-acting insulin upon presentation have impact in the outcome compared to those who has DKA, but you interrupt their long-acting insulin. So practice variation, and sometimes we practice both things, and that can be driving things for your research work. Patient patterns or treatment failure or guidelines gaps, all of this should and can be common source of research idea. Now you have that idea or you have that observation, and all of us have different level of clinical experience. So do you jump from having that idea into starting to write a proposal, or there is other steps you need to do them or to take them before you proceed for that? And before you design, you should have literature review. And why is that? To avoid duplicates. And having duplicate study, unfortunately, does not help patient, neither you yourself, neither the clinical community. And if you take it, for example, to our setup, we have a lot of diseases, they don't have baseline data. So starting with like doing a retrospective study to address a burden of a disease in the community is fine. But then when things will take it further, like we'll be having a study done in certain X training site, and then the same question will be asked in the Y training site, and the same question will be asked in say W training site. So that will be definitely duplicate. And what's the problem with that? That will dilute the interest of the readers, and that might create like unusual findings, and that actually waste of our times. And if it is exactly duplicated, you will struggle definitely to find a place to publish your work. And learn from others. Always good to have network, and this is one good example of network, like Now we have very excellent number of attendance, and then we can take it further. We can share our thoughts. Sometimes we can discuss. We can see what are the ideas that is feasible, idea not feasible, what are the best methods. We can cooperate at a cross-training site. And then we do your literature review. You should aim to identify the gaps. So for example, constipation among hospitalized patients. What is the gaps? Is it the prevalence? It is not known, or are the factors associated with constipation is not understood, or whether the treatment for constipation is something which is not obvious, or is it about the outcome for those who has constipation compared to those who didn't have constipation is a thing. So always you need to find a gap to be filled before you proceed further. And after you do literature reviews, that will help you to rephrase your question. Or, for example, if you talk about inclusion criteria, that will help you to decide whether you need to include more patients, more inclusion criteria, or you have to specify certain exclusion criteria, and that should be optimized by having proper literature review. Now, there is a lot of tools when it comes to literature review, but the common one or the historical one is PubMed. Now, the good thing about PubMed, it has a lot of citation, like about, you can say 35 plus million, and it is free. Later on, at the end of this presentation, I'll show you how to do proper search using PubMed. Now, with the improvement of AI, there is a lot of other tools came up, and definitely one of our upcoming session will be going deeply through utilization of AI to refine your literature reviews and to optimize a way to retrieve your data. So when you do exploratory search review, start with strategy. And basically, if we take constipation as an example, start, for example, broad, constipation hospitalized, and you put them in the PubMed, try to retrieve. If you have a lot of publication or citation come up, then refine your things and use MISH with MISH. So it stands for medical subject heading term. So it means when you have publication, what they do, they go to PubMed and then they try to put the keyword into special, like for example, constipation will be a term. If you have, for example, hospitalization, admit to hospital, all of them, they will come under the one terminology. And basically, this is a way of shelving publication and affiliate them with certain term. So MISH terminology, they are very specific. If you use them without understanding what they mean, you might miss a lot of publication. And then add filters. For example, humans, English, you are interested to look into last 10 years. For example, if you talk about recent development in management of heart failure, probably you are not interested to go more than 10 years. You might just limit that. So there's filters. And then start by reviewing the abstract and then pull the full articles. So now let's use the example of constipation. So start with when you go to advance, you put constipation and hospitalized patients and outcomes, and then you might be able to narrow that things. If you have a lot of application, you might go to use medical subject headings, and you do read, like explore the abstract, and then try to understand what is the missing things, what is the gap? Is it about the prevalence? Like, do we have prevalence of constipation in ICU, for example, has been done in surgical ward, have been done at level of community, or we have gaps, like all previous studies did not address the prevalence of constipation among hospitalized patient, which is like being admitted in medical wards. So is that the gap? If that's the gap, then data limited, probably you can consider that as your research question that you want to address. And one of the things when we study, like we look into constipation, we have not found any Middle East or Arab population study, which is the most actually of the times. Like you don't find a lot of study coming from our area. So basically what we did, we identify gaps, and that helped us to come with two high impact publication on them to address prevalence and risk factors to constipation, and the other one to look into the impact on whole health outcomes. So both of this study were publishable in high rank journal, and they receive a lot of citation, because as you go as a researcher, it is not only to make it to publication, you need to see impact. Impact equivalent to X or Twitter is a retweet. So, and our retweet when it comes to publication, it is citation. So there is other things as you go as a researcher, like you aim to maximize the number of citation, because it indicate whatever you have been published that were contributed to the global community interest of medicine, and your study has been cited. So citation per article, that will give impact factor, and that might translate or can translate into H index, which is one of the big things researchers are looking into when they want to apply for promotion. Now, you have done that process, curiosity, you identify question, and now you did preliminary literature reviews. Now you want to do it actually the proper one. Like now you decided this is the field I'm going to engage. I want to investigate how to make sure your question, when you put it there, you don't miss any publication. So you start with PICO. So this PICO is very important when you want to have structural literature reviews, and basically based for population, comparison, intervention, and outcome. Now take 10 seconds and think conservation things, how we can put a PICO framework. So 10-second pause. So the question can be like, is constipation among medical hospitalized patients associated with increased mortality compared to those who didn't have constipation? You put it like this, for example, question. Or you might ask more than one question about the same things, like, is patient with constipation has increased risk of readmission compared to those without constipation? So that, again, risk of readmission. And you formulate that will help you later on to come with terminology. You can plug them into your PubMed or whatever you use as a review to retrieve the all possible publication around that topic. So this is what it looked like. For example, this is the example delirium. So if we want to use our PICO delirium, so our population will be elderly more than 65, admitted to hospital ward, and will be what their clinical and demographic risk factors compared to those without delirium. And the outcome will be like having delirium within 24 hours. And research question, then if you want to refine it, can we predict which elderly patient will develop delirium within 24 hours of admission? So this is one of the things you can look into them. Always put in your back of your mind PICO, and that will help you to streamline your thoughts or idea into a question, and that question, when you have well-framed question, can be used to optimize your literature review. Now, when you start doing research, you get excitement, and sometimes you see something, you read an article in New England Journal of Medicine or Lancet or Nature, and you get excited, and you call or you meet one of your colleagues, like mentor, and you start to discuss the idea. I want to do this because I have read into, say, for example, New England Journal of Medicine. But always you need to think, what are the characteristic of good research question? So feasible, and feasibility indicate you can do it in constraint, like time with time constraint. For example, you have 3 years to complete your research project. And now if you talk about a question that look like, say, for example, your sample size is 300, and you see them, like you encounter very rare condition, you see one every, say, month. So then definitely you are not going to catch up. So time will not help you. And the resources, if you are interested to do something which is, again, require a lot of, say, very expensive medication, you don't have resources, that is not good type of questions. If your research question require a rare test that should be like sent away and you don't have the resources, like money-wise to do them, then it is not feasible. So think about feasibility. And feasibility, do you have resources? Do I have the expertise? Do I have the time? Do you have the patience? You don't start to talk about, um, say, for example, Marfan syndrome, and you calculate your sample size, 200 Marfan syndrome patients. Definitely, you are not going to achieve that one. And how that feasibility can be assessed by having discussion with a colleague and trying to understand your hospital. Like, for example, if we code general medicine unit, Sultan Qaboos University Hospital, we know that like total number of patients admitted every year to between 3,400, 3,000 and 4,000 patients. And we have done previous research, and then we can tell exactly what are likely number of patients be above 65. So when we calculate sample size, definitely we can precisely calculate the timeline required to complete our study. And then, is your questions interesting? So is that something you like as an investigator, or it is of interest to community and your colleagues? And what would be interested, depending on your specialty. Like if you talk about general medicine, there's huge interest in a lot of conditions. And now cardiology, again, what are the area of interest? And normal interest when there is something like there is a gap or there is novel treatment, or your question is going to address a problem. And always think about, when it comes to research, the likely to create impact. Those type of research, they address specific gaps or solve a problem. We don't do research just because we want to be like fastidious or want to like enjoy having luxury of publication. We do them to address a real problem, and that definitely by default will attract interest. Novel, it is very important things, but we have to acknowledge it is not possible for all people to work in novel things because resources wise, expertise wise, money wise, not possible. Ethical, and that is very important. You should not waste your time trying to write a proposal if your study is going to include something that represent risk for patient. For example, someone trying to study DKA, say, for example, and you want to compare those with insulin infusion compared to subcutaneous infusion for management of DKA. This is very risky, and already there's protocols, guidelines, already advise people to have IV, IV insulin. So trying to do that one is definitely is not, because DK is associated with increased risk of mortality and morbidity. So it is not safe to put people on subcutaneous insulin, and definitely that's by default going to be rejected. So putting all this proposal is going to be harmful unless you have specific justification or pilot study that previously ethical approved and show there is no inferiority for subcutaneous insulin. Impact and relevance to clinical practice. So put all of this question when it comes to your mind. Now you have 1 minute and think about a situation or an idea, or if you are R1, think about what things you are planning to do and try to put them in a PICO format. You have 1 minute, or can start counting, and please um, let us know when time passed.
30 seconds to go.
Thank you.
Time's over.
Okay, so whatever you have written, keep it with you, please. We're going to use it at one point of time. So now study design, this is very important. Now, basically, you're in process of thinking, you have your questions, and you want to think what should be the reasonable study design. So your research question is the entrance if you think about a building, and study design is the main process, and that will help you to make valid evidence. And basically, your study design should be driven by the type of question you want to answer, potential pitfalls with each of research design, and what are resources required to conduct or to use specific research design. Like, for example, retrospective require you to retrieve data from patient records, while a prospective study, it requires people to approach patients while they are admitted to take history or to collect some information. And definitely, as a resident, you cannot stay in the ward, say, for example, for 6 months every day to collect prospective data. So that by default, it means you need research assistant. And having research assistant, they don't work for you for free. You need to pay them. So then you need to have a budget. So always we think about this one. And then this question probably will not be addressed by observational study, and I need to do interventional study. Do I have the resource? Do I have the right patient? So all this should be driving your study design. And if you use the wrong study design, you will get a wrong answer. And that which will mean eventually you're not going to make it to publication, and basically you wasted your time. So I will try to be brief here. Hopefully one day we'll have another session to address, but what are the common research design? Cross-section, and basically, if you think about it, it is snapshot at a time, and they're best for prevalence. So prevalence of constipation among hospitalized patients, prevalence of hyponatremia, prevalence of hypomagnesemia, prevalence of whatever, and they are cross-section. So basically, you come to see the patient at certain point of time. You don't go forward, you don't go backward, and you want to assess at that one. And they are very good when we talk about prevalence incidence. Now, case control, always they have to be retrospective. And always they start with the outcome. And then basically you want to see those with outcome compared to those without outcome, and you go back to their history. An historical example is lung cancer. So you have people with lung cancer, people without lung cancer. You want to check in their history what are the smoking prevalence among those with lung cancer compared to those without lung cancer. So basically you start with the outcome and you go back to the exposure. Now you have the other type of observation study, which is cohort. And cohort, basically, you talk about exposure and then you want to see the outcome. And cohort, you can do them prospectively or retrospectively. So you have people with constipations or people medically hospitalized. So that would be like medically being in medical ward, that would be exposure. Constipation, it would be the exposure, and you are interested to see the outcome. So the outcome will be mortality or readmission. And then you can do them prospectively. So you start with those medically hospitalized, you follow them over time, and you see what their outcome when it comes to the things. Or you can go to the record and you can see those with medical admission, constipation, and that will be the way. And it is, again, best when you want to see the association. And definitely for observation, you cannot establish causation. It is about the association. And again, for example, delirium and mortality, like does people cohort of patient who has delirium at increased risk of mortality? And basically what you do, you take all hospitalized patients admitted to general medicine ward, you follow them prospectively, and you see, you compare those with delirium, how many of them died compared to those without delirium. So you started with exposure, which is delirium, and you want to assess the outcome. Or you can do that based on the record. So you open patient record, and then you assess how many of those with delirium died compared to those without delirium. So this is the most common type of studies. They go to publication, and they are easy to conduct. They provide some insight about important things like prevalence of certain disease or association. Now, the other things, randomized controlled trial. And that will help you. طبعا, this is the gold standard when it comes for treatment. And you try to compare either intervention with intervention or intervention with placebo. And they are best when it came to assess of the impact of treatment. Example of here, melatonin, the use of melatonin in people hospitalized patient prevention of delirium. So this is one type of study. What is the good thing? They are best to establish the causation, and they provide solid piece of evidence. The drawbacks, they're expensive, they need resources, they need a team, they need someone to prepare the medication, someone to be blind to the administration. So it associates with a lot of things. And then one of the excellent things, meta-analysis, like systematic view and meta-analysis. And I found this very interesting because basically when it comes to hierarchy of evidence, they are sitting on the top. But when it comes to the resources, you don't need a lot of resources. Even you don't need ethical approval. So basically you go, you come with a question, you do like a proper literature review, identify the study, you analyze them. And we have seen people who are doing systematic meta-analysis, they are winning actually when it comes to research competition, because we don't have a lot of RCT. And then when it comes to hierarchy, you find systematic meta-analysis, they are sitting on the top of evidence pyramid. So this is again, when it comes to the bottom of evidence, there is something missing here. So clinical expertise, they are sitting in the middle, then followed by case report, and then observational study, trials, and then systematic review and meta-analysis of RCTs. They are sitting in the top of the evidence. So if you want to match what type of question suitable for what type of study design, how common, if your question is about how common delirium among hospitalized patients, how common hyponatremia among hospitalized patients, that will be cross section. When it comes association, like what are the risk factors for mortality, what are the risk factors for readmission, that either case control cohort. When it comes to the outcome setting, can be prospective or retrospective. Does this treatment work? RCT. And when it comes to summarizing the evidence, systematic view can be done for observational study and can be done as well for trials. And each of those has like advantage and disadvantage. So why prospective better? Because standardized data collection, if you think about constipation example, like would you be able to do assessment of prevalence of constipation among hospitalized patients using retrospective data? Think about it. How good we are in documenting constipation in hospitalized patients. Like, is every single patient at the medical ward will be documented if he has constipation? Definitely no. So you are going to miss a lot of patients. And then when it comes to delirium, for example, would be able to do delirium prevalence using retrospective study? The answer definitely no, because we are not good at describing people with delirium in our thing. So then the best thing will be prospective, because they have standardized way of collecting data. For example, constipation, we use validated constipation assessment scale. For delirium, we use 3D CAM, and they are validated tools, and that make our approach in assessing both problems very solid. It means we included those who should be included, and we exclude those who should not. However, The challenge with prospective, they need resources, they need patience, they need follow-up, they need time, because again, recruitment might take 1 year or more. In comparison, retrospective is easy to conduct. What you need ethical approval, you need to retrieve data. However, you will stuck with incomplete documentation, inconsistent definition. For example, delirium sometimes will be will be described confusion, patient not communicating, patient drowsy. Not all these terms are called delirium, however, commonly used. Missing data. A lot of missing data will be in the files either because of whatever recall bias. And however, they are very good when you talk about rare outcome. Say, for example, some rare condition or that cause patient to be admitted in hospital. Like, for example, we have done a study with Dr. Hour Al-Ka'bi, who was co-partner in this project, about acute decompensation liver cirrhosis. And basically, we needed to go back to 5 or I think or 10 years of retrospective data, because if you think about it, do you see acute decompensation of liver disease come to hospital? Yes. But do you see them every day? Do you see them every week, or do you see them every 2 weeks? So when you don't have a lot of patients, then the only option for you to go back to retrospective data. So we discussed this example, and we have shared this other example. So now let's move to practical demonstration of how to do literature review using PubMed. So this is PubMed. You see there's advanced. How is that visible now, the PubMed?
Yes, doctor.
Okay. So there are a lot of ways of doing them, but I try to be simple, non-complicated. So I'll go to advanced, and then you see there's all filled. Okay. So all filled, there's a lot of things coming up there. So what I would like to use, like, do you want to see your search terminology coming in the title? Think about it. Is title of the study always they have everything you are interested? My common approach, I'll go to title and abstract, and that at least will help not to miss any important study. So that will be the way to look. And what will be the term? So basically, whatever I write here will be search if that terminology present into title and abstract. So for example, let's talk about our constipation. So constipation things, like prevalence of constipation in medically hospitalized patient. Is that the question? So let's write constipation. So I guess this is the correct spelling. So add. Then what will be the second term? Like we said, what is the prevalence of constipation, for example, among hospitalized patients? So we be prevalence. Okay, great. So now you see this one. This is one and or not. This is very important things. So for example, here I want to see in final, like in query box, I want to see both terminology they are present. I want this because they are different. So for different terminology, you add and. But say, for example, there's a condition that has more than one terminology, then when what you add or. For example, liver cirrhosis, liver failure, acute hepatic injury, if you're interested on this, so you put this and this and this. And that driven by your exploratory literature review. So one of the things, exploratory literature review, they will help you to come up with a research question and to come with research strategy. For example, if I am interested, I can take, for example, here, I would say, or, sorry, that I should go back. That's not what I meant to do. So what I would say here, I would say prevalence or incidence. And then I will add both of them. and make sure there is no spelling mistake, by the way. Otherwise, we'll strike. So basically, prevalence, and sometimes they report incidence instead of prevalence, so that will be all. Now, hospitalization. Is there anything other term equivalent to hospitalized? Sometimes what they say, hospitalized by Z, hospitalized by S. And then we'll add. And you can see it there in red, so it means there is a problem. There is some medical error, some errors there. This one is all right. So what I will do now, I'll search. How many yield of the search will result? Let's explore. So there's a problem with the search. Is there a problem? There's no problem, actually. You can see a lot of research. There's 91 result. So now you can use the filters. You see this in the lateral things, in the edge. Can you see my pointer?
Yes, doctor.
Okay. So you see studies from 1985 till 2025. So again, are you really interested to go all the back? So I can push this one. I can pull it. I can minimize. For example, I want to see only last 10 years, and that will limit to the things. So, text availability, I would recommend to keep this without ticking, because if you are doing real research, you should make all effort to retrieve the article whether it is present or not present. Now, are you interested into book or document, or clinical trial, meta-analysis, RCT, reviews? You can narrow or do things. Are you interested in English or Spanish? Always, I will keep it without tick. If there's Spanish article, you can easily translate them. Are you interested in constipation among animals? I would say no. So definitely will tick that one. And that actually eliminated 20 articles. So 20 articles were about constipation among animals. And then, are you interested about adult or pediatrics? Let's say, for example, adult. Or you want to see geriatric. Let's see adult. We'll take this one. And then let's see if we take geriatric, if anything will happen. Nothing happened, basically. Why is that? Because the adult, they include 19 plus, which include 65. But if I untick this one, they include only people above 65. So you can see then, and your next question will be screening them. Prevalence and risk factor of constipation in trauma patients. So are you interested in this one, or you want to see other things? And you screen through them. If you are interested, you can look into this one. And if you like that article, you can download it and you can include to your EndNotes, so you can retrieve all other things. So this is a simple way of doing search using PubMed. I hope this is clear. However, if you didn't catch up with this, don't worry. That will be a dedicated session about literature review, including using the AI tools. Now, there are recent development about using the AI tool in literature review, and that will be very useful when you are doing your exploratory literature review, or when you have very quick question you want to identify on the spot. You are seeing the patient in the clinic and you want to do things. And one of the things will be consensus. And there are different account. I think I didn't sign up here, so this is a free one. And basically, what you can ask, what is the prevalence of constipation among medically? So you write it, whatever there is let's just make sure constipation correct. Intentionally, and I left, there is medical error, like a spelling error there, there's spelling error there, spelling error, because this is work by large language model. So by default, they will recognize the things and they will come with the right word. So this is equivalent to ChatGPT, but it's special about it because what they are retrieval data is literature publication only. So whatever is coming will be just citation. And let's see the things. And there is also filters about this one. So now it is searching, trying to identify, definitely by default, now they identify the correct question, they correct the spelling error there, and they will come with the things. And there's a lot of function in this one. There's filters, and you see constipation in medical hospitalization, prevalence of overviews. So it can tell you a lot of things. If you're interested here, for example, say this is general medicine unit 53. I'm suspicious this might be our study, and actually this is our study. So consensus recognized Dr. Jawahar Nomani is the top one. So if you go to, if you're interested in this one, you can see the details of the study. It wanted my emails. Okay, because there's one of the subscription function. So I'm subscribed, but I'm trying to show you the free one. You can do, at least they'll give you the year, the title, the other things. If you want to download to EndNote, you can use this function. So that directly you go there, export to EndNote, you put it from there, and then you can open it easy in EndNote. So this is one of the good functions there. And basically give you a summary about a lot of things. If you push in this function, again, this is one. So they minimize actually a lot of free options used to be happen, but this is, I believe, honestly, it is good for a lot of us. You don't need to have all that additional feature. Additional feature, they are amazing, but this one itself, it is more than enough, honestly, to start your primary literature review. We'll have another session with Dr. Muhammad Rawahi to share a lot of other AI tools, and we'll discuss the pros and cons of each of them. So feasibility is very important. And again, when it comes to assessment feasibility, as we discussed, do you have the time required? Do you have the resources? Do you have the expertise? Is it ethical to be approved? Do you have the enough data? So in summary, your research roadmap should include observation driven by curiosity in clinical field, and that likely would be driving a good questions, and you do exploratory literature review to make sure it is not a duplicate. It is something of interest to readers that will help you definitely to reshape your questions to come with more things, and then you put it in PICO format, and then you do the literature review, and based on that, now you have sort of idea how I'm going to do to answer my question, and that will be taking you to what type of study design you are going to see. Is the retrospective studies enough? And that will be helped to be answered by your exploratory literature review. Because, for example, you find a lot of limitation of previously done study, recall bias. So then, because of literature review told me there's a lot of recall bias in this type of question, then I should do prospective study. And then you assess feasibility. If things are right, then you go to the next step, which is developing protocol or your ethical approval plan. So take home message for today: curiosity first. You don't start doing duplicate questions that it is not that they are not going to add anything to literature review, literature community or the scientific community. And if they are not going to attract the interest of people, they are not going to be cited, which indicate your impact factor as a researcher is not going to be benefited from having this type of study. And once you have that ideas, which is vague idea, if you want to reframe it, then you move to the next step, which is doing exploratory research reviews using PubMed or AI tools. If you are so interested, then you put in structured question or questions. Most of the time will be questions like, what is the prevalence of constipation among hospitalized patients? What are the impact of constipation in terms of mortality? What are the impact of constipation in terms of readmission? What are the medications associated with increased risk of mortality? So you come with the questions, and then you decide how will be suitable the study design. You collect the data, and then you create your final manuscript, which will be suitable for publication. So your action item this week, please identify one clinical observation from your practice, write it in PICO format, conduct a PubMed search on the topic. I have shown you how to do PubMed search, and make sure that be done after you formulate your PICO questions. Choose study design, bring your ideas to the next session, and next session we'll try to go through doing like comprehensive teaching into PubMed literature reviews, and then we'll share some AI related tool which are very useful to the things. Dr. Muhammad Rawahi, welcome to speak. Dr. Muhammad.
Thank you very much, Abdullah. Amazing talk, and inshallah we'll talk about some AI tools in the coming few sessions. Shukran, Abdullah. Amazing.
Inshallah. So if you have any questions, feedback, you can send them to the link which is available on the website. For all of our announcement will be available in our website. If you have any question, if you write anything, or is there any question written in the chat icon?
Not yet, Doctor.
Any question? We don't want to exceed our time. We have 3 minutes only. Okay. So what will happen next? The series of lectures will be trying to build up from, as we saw today, from what sound like basic idea, but very relevant and important. And then we'll take it step by step. We'll definitely pass by AI tools. We'll talk about conducting the actual study, data collection, hints, writing manuscript, prepare your manuscript for publication, publish in prestigious. So basically start from the scratch into making your work into publication. And that will happen hopefully over the next 6 to 1 year, inshallah ta'ala. Thank you all for your time. I will see you again in 2 weeks. Massalam.